Ladies and gentlemen, esteemed guests, welcome to the 2024 South Africa South Korea Medical Industry Seminar. My name is Johnson, I'm from Kotra, and it is my honor to guide you through this event today. Without further ado, it is my pleasure to welcome Ms. Myung-hee Kim, Regional Director General for Kotra Africa, for the opening remarks. Thank you, Ms. Kim.
Honored guests, distinguished partners, ladies and gentlemen, good afternoon. It's my pleasure to welcome you to the South Africa, South Korea Medical Industry Seminar. The relationship between South Korea and South Africa in the medical industry is one that continues to grow stronger year by year. Korean companies have been at the forefront of developing cutting-edge medical devices, pharmaceuticals, and health technologies, while South Africa as a gateway to the African continent offers a robust and dynamic healthcare environment with immense potential for collaboration and growth. I encourage all participants to take full advantage of today's program, whether it is through the informative presentations, insightful discussions, or the invaluable networking sessions. Let us work together to bring tangible solutions to the medical challenges of today, and most importantly, to build a healthier tomorrow for all. I would like to thank all of our partners, participants, and sponsors for their dedication and support. I wish you all a productive and successful seminar. Thank you.
For your kind remarks. Next, we are honored to welcome His Excellency Ambassador Dong-han Yang, the Ambassador of Republic of Korea to the Republic of South Africa, for the welcoming remarks.
Yes, good afternoon. I'm Dong-han Yang. As I was introduced, and I'm Ambassador of Republic of Korea. I'm very pleased to welcome you all to the Korea South Africa Medical Industry Seminar here in Cape Town. I'd like to extend my sincere thanks to all the speakers, Director Rashmi Raghavan from DTIC and CEO Tanya Vogt from the South Africa Medical Device Industry Association, and the CEO Sarah Cohen from the South African Laboratory Diagnostics Association, and Mr. CEO Sizwe Makawe from Tech Pro Health. Your insight into the current state of South Africa's medical industry will be very highly invaluable for our discussions today. I believe it should start by noting that this seminar brings together not only distinguished experts, but also business leaders from both Korea and South Africa, providing an important platform to explore potential business collaborations. I trust that this will be a constructive opportunity for companies to explore new avenues for cooperation in the healthcare sector. Furthermore, I'd like to underline that since the establishment of diplomatic relations in 1992, Korea and South Africa have forged a strong partnership in a wide range of fields. Among them, healthcare and medical industries are rapidly emerging as areas where we see enormous potential for further collaboration. Especially the COVID-19 pandemic has brought to light the importance of international cooperation in public health, and both Korea and South Africa are taking bold steps in response to this challenge. As many of you may know well, Cape Town was designated as a hub for mRNA vaccine technology transfer by the WHO This marks a significant milestone for South Africa in enhancing its vaccine manufacturing capabilities, not just for the country, but for the African continent as a whole. Meanwhile, Korea has been designated as the global training hub for biomanufacturing, where we are committed to providing the expertise and capacity building needed for global health security. South Africa is now one of the key countries in Africa with the capacity to respond to future pandemics through vaccine production. Korea, too, is eager to collaborate with South Africa, not only in vaccine technology, but also in the broader areas, where including diagnostic devices and medical equipment. And therefore, I believe this seminar is timely, as it provides a unique opportunity for us to discuss ways to enhance cooperation in these critical areas. In particular, South Africa's high prevalence of HIV and tuberculosis presents serious healthcare challenges. However, it also underscores the urgency of improving diagnostic tools and treatment solutions, which is an area where Korea has highly advanced technology, and Korea can bring about a meaningful and positive change. By working together, we can significantly enhance the diagnosis and treatment of this disease, and in doing so, we can improve the health and well-being of millions of people. In addition, I would like to underline that beyond healthcare, South Africa serves as a gateway to the African continent for Korean companies to expand their business opportunities in Africa. I sincerely hope that today's seminar will provide an opportune moment to discuss how Korea's world-class health and medical manufacturing technologies can support Africa's efforts to strengthen its pharmaceutical and medical devices and the biotechnological sectors in collaboration with South African counterparts. The Embassy of the Republic of Korea stands ready to support these efforts and will continue to work closely with all stakeholders to ensure that this collaboration grows more stronger in the years to come. I wish you all a fruitful and engaging seminar today and look forward to seeing the promising outcomes of our discussions today. Thank you.
Thank you, Your Excellency, for your warm welcome and encouraging words. Now we will start with the official seminar presentations. Please join me in welcoming Ms. Tanya Vogt, the Executive Officer of the South African Medical Technology Industry Association, for her presentation on the South Africa medtech industry status and outlook. Thank you.
So, good evening, His Excellency, Ambassador, also representatives from our Department of Trade, Industry and Competition, and thank you very much to KOTRA for the invitation, and to all the colleagues and guests. So, thank you for this opportunity. So, I'm Tanya Vogt. I've been with SAMED since 2007, quite some time. I'm going to share with you a little bit about the association, what we do, and then share with you about the landscape and doing business in South Africa in terms of our sector. I have a video that I'd like to share with you. Let's just see. Slides aren't changing. If you can give me a hand, Johnson. Also change like that. SAMED's vision is really to ensure a sustainable, transformed and ethical medical technology industry in South Africa.
SAMED plays such an integral role in the medtech environment and healthcare.
Really shaping the healthcare industry. Why Summit? In South Africa, healthcare is a constitutional right, but it's also a very dynamic space going through lots of change.
The big one for me has been how we've been driving diversity in the industry.
Summit just gives me all the information that I need to manage my business.
This is excellent forum for us to network.
We believe in being a voice for all medical device companies for the benefit of the patients.
There is a massive amount of behind the scenes work that gets done, just really helps us to make sure that we can close deals.
The small SMMEs, we get to learn each and every day.
It's been a very inspiring and motivating event so far.
For us, a voice for medtech companies definitely helps in addressing some of these issues that we experience annually.
Collaborate, understand the challenges that we're seeing, share best practices, share ideas.
We are bringing meaningful value to our members.
Summit is nothing without the members and the drive of the members. That's what we strive to do.
In my view, we need data, and we need data with integrity.
We've been zooming on women in medtech leadership programs and forums, and also captains of the industry.
These forums act as an opportunity for women in medtech to share, to grow, and to create linkages amongst themselves. Just one way of ensuring that we bring about women empowerment in the medtech sector.
Leading this medtech industry, representing the best.
We are able to get a number of players in a room, and when we are collectively developing policies and programs, we are also able to take the inputs.
What is interesting is the diversity of topics that are covered around the joining of hands between the multinationals and the potential for local manufacturing in this country.
For us as a regulator, being able to engage with industry where we can share what our plans are is always of great benefit.
To have one voice, how we can serve healthcare and the patients better.
We have to collaborate, and that's what Summit does. It brings us together so that we can work together and actually create a better environment.
This voice that Summit has can elevate beyond an individual company, raise the right issues at the right level, but also support industry in growth.
Summit's such an amazing organization. We just love being a part of it and connecting with everyone.
We are finally elevating medtech.
Summit, together we tackle problems.
Advancing patient care through medtech.
So who are we? We were established in 1985, and we are a not-for-gain voluntary trade association. Currently, we have 151 medical device or IVD companies, and we do have some associate members, of which Kotra is one of them. So we really stand for driving an ethical and accountable medtech industry in South Africa. All our members have to abide by and are bound by a code of ethical marketing and business practice, and we have a hotline that transgressions can be reported. We advocate for international best practice and harmonization, particularly with regard to medical device and IVD regulations. We advocate for value-based reimbursement and procurement, and also promoting access to innovative medtech in South Africa. In terms of the benefits that we offer our members, certainly there is an opportunity to network. I've always said to Kotra and Johnson that if any South Korean medtech companies are looking for partners, we have a newsletter, and we would be most willing to share that information via our newsletter should you be looking for a local-based partner in this space. We hold a variety of forums, at least one or two every single month, where we're looking at topics like what's the latest in terms of regulatory requirements, not just in South Africa, but even in Africa. As was mentioned, South Africa is often seen as a gateway into the rest of Africa, and more we are seeing other African countries implement medical device and IVD regulations. So we're helping our members to navigate that space and to really have the information that they need right at the tip of their fingers when they need it. We're also a member of the YES program. So YES stands for the Youth Employment Service Initiative. South Africa has one of the highest, if not the highest, youth unemployment rates in the world. And so as industry, we have decided that we will make a difference. And at this point, 42 of our member companies have signed up to the program. SAMED joined in 2019. What this program does is, you may have heard in South Africa of broad-based black economic empowerment. Many of the multinational companies in South Africa find it difficult to achieve a good black economic empowerment level. And in fact, in the private sector, many of the private hospitals will not procure from you if you are above a level 4. So there are 8 levels, and obviously the lower your level is, the more empowered you are. But multinationals can't sell ownership of the organization. But they can improve their BBB scores by participating in the YES program. So it doesn't just support black economic empowerment, it also supports employment of youth and also upskilling youth in the medtech industry. So to date, we've had 3,247 learnerships created for youth, which has been in the region of 183 million rand in salaries that has been injected into the South African economy and into communities. Also was mentioned in the video, we've embarked on a Women Empowerment Index. It's a voluntary index. Our members submit their data, and at the end of it, they have a certificate which gives them a Women Empowerment Index score. They can use it in their marketing and even in tender processes. We are seeing more and more in South Africa that there are transformational goals that the public procurement entities are wanting to meet. And as some of the tender criteria, they actually want to know the percentage of youth ownership or women ownership in your organization. So we're starting to measure those metrics because we believe if you don't measure it, you can't manage it and you can't change it. Just in terms of the medtech sector and the types of companies, so SAMED has a variety of members. We have multinationals, we have distributors, and we have local manufacturers, and we also have wholesalers. But by and large, the majority of the medtech companies in South Africa are actually small to medium distributors. So at this point, about 90% of all medical technologies are imported. So we are quite a significant contributor to our country's trade deficit. And I'll talk to how we're trying to address that later on. So why South Africa? South Africa is an attractive and connected market. It is the second largest economy in sub-Saharan Africa. It is the most affluent consumer market in Africa. It is the most important industrial hub on the continent. We have well-established infrastructure. It's in a strategic location. We don't have load shedding anymore. Yay! So there is certainly, if I did this presentation perhaps a year ago, I do believe that there is a better outlook economically, and there is a lot of optimism in our country at this point in time. And we're a springboard into the African region. I won't go into all of the other metrics, but as you can see, we're well placed in terms of doing business in South Africa. Where to invest? So there are certainly some hubs in the country where, in particular, importers, multinationals are based. Gauteng especially, we see a lot of regional headquarters for medtech companies. We do see some local manufacturers based there, but certainly in KZN and the Western Cape in particular, these are areas where we are seeing a lot more local manufacture in the medtech sector, and especially in terms of R&D in the Western Cape. So if we look at some of the indicators in terms of the healthcare market, this is just a comparison with Egypt. Maybe next time I must get South Korea's data and compare you to South Korea. But our life expectancy on average is 64.4 years compared to Egypt of 70, and our healthcare spending is sitting at about $40.8 billion. And these are not recent figures, so they are a little dated. This was from about 2019, so forgive me. As you saw in the video, we need data, and we need data with integrity. Our sector, there is not that much data out there. And I think it's more than likely because we are a relatively newly regulated sector, unlike the pharmaceutical industry. Okay, but just out of interest, healthcare spending per head in terms of US dollars, 675 compared to Egypt. So we certainly spend a lot more per head in healthcare than Egypt does. So we have two main sectors, a public sector and a private sector. The public sector accounts for about 85% of the population, but only about 48% of the health expenditure. Our private sector provides 15% of the population, about 9 million people, and those are primarily people who can afford private healthcare insurance, and that accounts for 52% of health expenditure. And in the private sector, physicians are self-employed. So you can see there is a massive disparity in terms of the numbers of people who are treated in the public sector as well as the spend. And this is one of the reasons why we now have a National Health Insurance Act, which was recently passed, to reduce that disparity. So both sectors offer a wide range of services, from basic to very modern and innovative services. And really, the public sector is broad-based, and although you will hear many criticisms about the public sector, it still remains the leading health sector in sub-Saharan Africa. The public sector is the largest purchaser of medical devices and IVDs and equipment, but the demand for innovative medtech is very strong in the private sector. So in the public sector, we have a range of different types of hospitals: district hospitals, regional hospitals, tertiary hospitals. We also have a national defense force that procures, and we have a National Health Laboratory Service that procures for its labs nationally. I mentioned broad-based Black economic empowerment. This is a criteria for doing business in South Africa, not just in the public sector. It is becoming more important in the private sector, and certainly companies do need to have and work towards improving their BBB scores. And there's a range of levels and areas that you need to work on, like ownership, leadership, corporate social investment, enterprise development. These are all scored. You also have to report on these annually, and you get a particular score, which you then have to disclose to government when you are selling to them or for tenders, and also to the private sector. So National Health Insurance, our act was passed, and our government, our Ministry of Health, is working hard to start implementing the National Health Insurance. One aspect of that act is a health technology assessment. And there is a unit that will be housed within the National Department of Health that will be dedicated to health technology assessment. Another unit within the National Department of Health is around procurement. So the National Department of Health will become the sole funder and procurer of products, pharmaceuticals, and medical devices in terms of the National Health Insurance benefit packages. This is going to be a major change in terms of how we do business in South Africa. Regulations still need to be promulgated. There's still a lot of work to be done, but certainly our government is adamant that we will have a national health insurance system in South Africa. In terms of the private hospitals, there are three main private hospital groups. They are quite powerful. It can be difficult for new entrants to get into that market. So generally, I would recommend that you look to partner with a local company or a local distributor that has a good footprint, that has had experience and has been a supplier to that market. But these are Netcare, Life Healthcare, and Mediclinic. What we are seeing, though, is an increase in daycare clinics and hospitals. So just to compare treatment costs, for example, compared to what it might cost in US dollars. In general, this is in the private sector. So just a routine checkup at a family doctor on average will cost you about $39.3 US, and it's about 10% of the monthly personal disposable income. So you see that healthcare is quite expensive in the private sector in South Africa, which is why you need health insurance if you are going to make use of the private healthcare system. And this is also one of the reasons why our government is moving towards a national health insurance, because it really is just too expensive for the average person. Okay, in terms of getting your medical technologies into the private sector, these have to be approved by the major medical funders. So one of the biggest funders in South Africa is Discovery, and they do an HTA or an evaluation of the product, and only if they agree to reimburse it, then you will most likely be able to get it into the private healthcare sector. Okay. So just, I mentioned that the majority of medical devices are imported into South Africa. I won't go through the detail, you have the slide, but this just gives you some statistics on the extent of the imports. Our sector is valued at about 29 billion rand, and it is expected to grow to at least 49 million rand in about 2028. So we are seeing very good growth in our sector compared to other countries in the world, particularly in Europe. We're seeing double-digit growth compared to single-digit growth. Okay. Yeah. I think Sarah will talk about the infectious diseases, but certainly one of the reasons why we're seeing this increased uptake of medtech is because of our rapid increase in non-communicable diseases. These are lifestyle diseases, obesity, diabetes, cardiovascular, hypertension, cancers. We're seeing a massive increase. TB and HIV are still at the top of the list, but certainly we're seeing these other diseases starting to catch up. And also in South Africa, we have a massive rate of trauma-related incidents. So orthopedics in particular, implants, etc., is quite a good market. These are just some of the local manufacturers that are based in South Africa, and quite innovative companies. I don't know if you know, but the CAT scan was actually invented in South Africa by a South African physician. In terms of digital health, our National Department of Health is really focusing on digital health and using it to support the National Health Insurance System. They're developing a complete health electronic record that will improve patient management, digitization of health systems, an integrated platform around that information system. So they really are spending a lot of time and energy on digital health services. Just very briefly in terms of regulations. So we are relatively a newly regulated industry. In fact, our medical device regulations were only published in 2016. And at this point, all you need to get in South Africa, other than if you sell electromedical equipment, is what is called an establishment license from SAHPRA. Okay? That's the details of the senior manager for the medical devices unit at SAHPRA. The license is valid for 5 years. There are 3 types of licenses, either a manufacturer, a distributor, or a wholesaler. There are different prices depending on what type of license, and you also have to pay a renewal fee after 5 years. You do have to have an authorized representative, which gets logged with the regulator. You also have to list your products, not registration at this point, but listing. And the regulator does ask where the products come from or what mark they have. But unlike for electromedical equipment, where the CE mark is the requirement, for other medtech products, you don't need any particular mark, but you do need to state what if you do have a particular mark or where the product is coming from. And what will become mandatory as of January 2025, every single medtech company in South Africa, other than those that have Class A, non-sterile, non-measuring medical devices, will have to have ISO 13485 in place. And except for wholesalers, they're busy considering whether they're going to make that a requirement or not for wholesalers. But certainly distributors and manufacturers, in order to renew your license, and if you want to get a new license, you'll have to have ISO 13485. So to come, at the moment, our regulator is busy with a product registration feasibility study. We are also awaiting amended medical device regulations to be published. We anticipate that after the feasibility product registration study is done, we will see a call-up of medical devices for product registration. There will be fees that you will have to pay. We anticipate they will start with your high-risk devices. In South Africa, devices are classified Class A, B, C, D, depending on risk. And we also anticipate that they'll look at those devices or IVDs that are associated with our public health main issues like TB and HIV. We have also seen this year, I think it was this year, two policy documents that SAHPRA published for comment. One is around a BBBE policy. So they are considering implementing a requirement for prioritization of licenses linked to your BBBE score. And they're also looking at how they can enable and support local manufacturers of vaccines, medicines, and in time, medical devices. And that will also be linked to some prioritization in terms of product registration. They will never deny a company, if you are not a local manufacturer, getting a license or product registration, but they're looking to prioritize locally manufactured medical devices, vaccines, and medicines. Those have been published for comment. They're not yet finalized. And then we have this year in May, the publication of a medical technology master plan. It took a good 3 years under leadership of the Department of Trade, Industry and Competition. The focus is to reduce the trade deficit that our sector is causing. We are the 5th largest contributor to the trade deficit in South Africa. Another key focus is to employ more people in our sector, 1,000 new people within 5 years, over the next 3 years, and also to digitize and use artificial intelligence to enable proficient regulatory processes. So industry is working with the Department of Trade, Industry and Competition. We're in the process of appointing a project manager, but this is going to be at least a 5 to 10 year plan to grow the local manufacturing medical devices and IVD sector. And thank you. We look forward to you doing business in South Africa.
Thank you, Ms. Vogt, for that insightful presentation and outlook on South African medtech industry. Next, we welcome Ms. Rashmi Raghavan, the Director of Advanced Manufacturing from Department of Trade, Industry and Competition, for a presentation on investment in South Africa, the opportunities for healthcare. Thank
you. Good evening, everybody. And I want to just say thank you very much to the Ambassador, to Kotwa, for giving us the opportunity to present on the opportunities for investment in South Africa. So my name's Rashmi, and I represent the Investment and Spatial Industrial Development branch of the Department of Trade, Industry and Competition. I also have my colleagues that are here from our investment branch. They are at the back of the room, Viranzo and Vitumetsi. and also colleague Gillian from our policy division that looks after the regulations, the master plan, and the regulatory and industry-related policy developments associated with the sector itself. So, you know, just coming from listening to what Tanya has already presented, I think it gives you a already a very good scope of what the country has to offer itself. But what I would talk about is how, as a division, we are able to assist companies that are coming to set up manufacturing facilities in the country itself, and the role that we play in terms of hand-holding you through the process of connecting you with the different stakeholders and institutions and individuals that are key and critical to your investment life cycle in setting up the manufacturing facility. And I keep mentioning manufacturing facilities is because, as you heard in the previous presentation, that we have a high level of imports within the country in terms of imported products, and we certainly want to have locally manufactured products within the country. And locally manufactured products can come in a number of different ways, one being setting up a subsidiary in the country, but also being able to partner with local companies that have like-minded values, that you see a fit for purpose with, and that you can connect with in order to be able to produce, because they already have capacity or capability in the country. And considering that they already know the regulations, they already understand the landscape, we always encourage these particular partnerships. And these partnerships can come through the different associations that we work with. We also have a database within the department that we can provide a listing of companies that you would then need to take conversations forward as well. This is just really in terms of what looks at, you know, from a industrial policy perspective in terms of the embedding of our industrial policy itself, and certainly what drives the department in its core mandate. So when you look at the anchoring of industrial policy at, you know, as a central point in terms of our governmental agenda, it's really to address a number of challenges that are already faced in the country itself. But then when you look at what our industrial policy aims at doing, it's really to look at how do we increase growth, or how do we have inclusive growth combined with the transformation that we want to see in the country. How do we boost local production, grow our exports, and expand our African trade and African footprint? How do we continue to increase investment? And how do we also do this in terms of also creating a reliable and low-cost energy system whilst greening the economy? And I think this lends itself to all the conversations that are now being held globally in terms of decarbonization, looking at the climate change and looking at the energy resilience and energy security. But, you know, when we look at growing employment, because that seems to be core to what our government's agenda is really about. It's how do we grow those jobs because of the high levels of unemployment that we have in the country itself. And then to be able to look at what is our industrial core priorities. And this comes out of a joint, or out of a statement that comes from our Government of National Unity. You would recall, and for those that are in the country from Korea, we do have a Government of National Unity that has prioritized economic growth, economic development, but more focused on really industrialization, focused on transformation, and focused on building a capable state. And I think when you look at these things, it really speaks to what the government wants to achieve, and you'll see this general trend, or these particular words being utilized across government, because it's not only stemming from a Government of National Unity, but it's also stemming in terms of the president and what he wants to achieve for the country as well. Then I thought I would just give you an idea of how we are structured within the department. So, you know, as a company and as companies, you may touch point with the different branches or the different divisions within the department itself. And whilst, you know, we come from the branch that's called investment and spatial industrial development, But we encompass investment. We also encompass special economic zones as one of the instruments that we use. We encompass the one-stop shops that we have in partnerships with our provincial economic development agencies. And we now have recently also established the energy one-stop shop, again, in light of the number of energy projects that are increasing within the country. But the energy one-stop shop really is about also streamlining the non-financial support that can be provided to companies that want to invest in the energy space. Then we have a unit or a branch called the trade branch. This really looks at how do we leverage the free trade agreements and the preferential trade agreements and our engagements at a bilateral and multilateral level in terms of opening up access to markets for our locally manufactured products, but also addressing non-tariff barriers that maybe companies are encountering, and being able to then negotiate at a country-to-country level in not only streamlining the businesses between the companies, but also strengthening the relationships between the countries. We also have a division that looks at regulations, so consumer and corporate regulations, and this really looks at your consumer protection, your consumer products, your copyright, patents, and advice on these particular elements that are embedded in a number of companies, especially high-tech companies itself. Then we have a branch which looks after sectors, so policy development, regulation, industry development, specifically focused on the master plans and the development of master plans, the healthcare master plan being one of the plans that is within one of the sectors within this particular division, but really focused on how do we create that enabling environment that companies need to thrive whilst operating in the country. Then we have our transformation and competition unit or division, and our competition really looks at the competition laws, amendments to the Companies Act, employee share ownership schemes, and how to be part of that. And when it looks at transformation, which is a critical pillar in terms of really accelerating economic growth, we also have the Black Economic Empowerment legislation. And when we say the Black Economic Empowerment legislation, we have a unit that specifically focuses on unpacking that legislation, helping companies to understand what is required of them and to be able to utilize instruments that may be critical, or to be able to look at alternative options from a transformation perspective, even at an industry level, that can be engaged with officials from that division itself. Then we have an incentives division that looks after financial support programs, some generic to manufacturing, but I do have a slide that looks at the different programs that are offered by the department. And then we have a unit that looks at export, because we not only produce for the local markets, but we certainly want to take those particular products and export it to the rest of the world and the rest of the region. And then we have our corporate management division that, of course, manages the department itself from an administration point of view, and our research branch that looks at statistics and research that that help the department to develop policies and programs that support businesses itself. Just in terms of what we as investment do, our focus is really on investment promotion, investment facilitation, and aftercare. And so the idea there is to really help companies that are looking to set up in the country, to provide them with information, to go into those countries, identify the companies that could set up investments in the country. And we also coordinate, the investment climate reform program and the ease of doing business. And the ease of doing business is really to help companies in a more streamlined effect to be able to do business without all the bureaucracies. So as Invest SA, we work very closely with the presidency through Operation Vulindlela to be able to unlock and to be able to unpack some of the challenges that may be arising for the industry, and to be able to unlock those with the help of the presidency itself. We also develop develop an annual pipeline of investment projects. And these particular projects are not just so that we have projects, but it is to showcase the industrial capability, the industrial capacity, and to be able to showcase what companies are doing within the country, to showcase to other countries that we do have the capability and capacity to partner with like-minded companies from other countries to be able to take production to much higher levels, to streamline processes, but also to increase production and use it from an export point of view as well. We have been responsible and continue to be responsible for the implementation of the presidential investment drive and conferences that have been held over the last 5 years, in which we have 317 companies that have made commitments over the last 5 years and at varying stages of implementation and rollout of the products that they committed to manufacture itself. We also exceeded the 5-year target that was set by the president, and certainly are in conversations at the moment on the next investment conference, of course, in discussions with the presidency. We're also the Secretariat for the Presidential Investment Council, and we're also responsible for the designation and implementation of special economic zones and the industrial park support programs. These particular instruments are actually utilized as an instrument to embed and attract investment into specific locations across the country. Just in terms of our focus, we look at investment mobilization, we look at the investment promotion and facilitation, we look at retention and expansion, so helping the companies that already have a footprint in the country. We look at our one-stop shops and the utilization of our one-stop shops to assist the companies that already have a presence in the country. And then the ease of doing business, which we partnered with the World Bank, and now through Operation Vulindlela, we've partnered with the presidency. Just highlighting why South Africa as an investment and a preferred investment destination. Certainly, I think some of these are just repeated and reiterated. But you know, the opportunity, not just the market in South Africa, but the market for the region in terms of Africa. Location, because we're one of the most diversified industrial hubs within Africa itself. And we have a dedicated team within Invest South Africa to help you with facilitating the investment, but also hand-holding you through the process itself. Just why investment and how this impacts or translates into benefits for the country. Certainly from a fiscus point of view, the foreign direct investment that comes into the country, the jobs that are created, the tax that's infused into the national treasury, suppliers that get developed, technology transfers that happen between companies and countries, the skills transfer that happens, more efficient processes for plant manufacturing, the empowerment and establishment of industrialists, SMME development and procurement from SMMEs, and the enterprise development. So there's a number of multiplier effects that are associated with bringing investment into the country. And when companies like yourselves invest in South Africa, this is what you really are contributing to, a number of different levers that impact in terms of the country, but that impact on the lives of the people of the country in which you're operating. Just our sector focus, and whilst the focus here is on healthcare, but we do focus on the green economy, we focus on the resource-based industries, we focus on the service industries, and within these particular industries, there are a number of sub-segments and a number of sub-segments that can be affected in terms of investment. And we will share with you, we also have different leads that look after these particular sectors within Investment South Africa, and certainly happy to put you in touch with them itself. Of course, the focus for yourselves may be in the healthcare sector for today, and we do have the teams already sitting here that you can engage with going forward. Just also other sectors of priority for the South African government, and especially for the Department of Trade, Industry and Competition, is manufacturing. And then on the advanced manufacturing, of course, it is the electronics, it's the white goods, it's the pharmaceuticals, the medical devices, your aerospace and defense, and battery manufacturing and fuel cells. Okay, it's not... This is just, we have 9 provinces, and we thought that we would just indicate the sectoral strengths of the 9 provinces. Some you may find that are duplicated, but that's because there are competitive advantages in some of these provinces for specific sectors itself. So whilst the focus in KwaZulu-Natal may be on the clothing and textiles, the agro-processing, the motor vehicles, the transport and logistics and tourism, whereas in the Free State you may have that it's on agriculture and mining, petrochemicals and tourism, and then in the Western Cape it's the tourism, it's the ICT, it's fintech, it's also the medical cluster, it's the renewable energy. Gauteng is really the hub. So, you know, your financial and business hubs, a number of other sub-segments, and across the different sectors that can be housed within that particular province. What we try to do is we try to encourage companies to diversify across the sectors, because we do believe that through the development and through the niches associated with the sectors, depending on the value chain that you want to play in, you may want to hub or you may want to set up your facility looking at a number of factors into consideration. This is just some of the investment opportunities, and I think from the previous presentation, Tanya also mentioned a number of imported products, you know, in terms of value. And when you want to reduce the import deficit, those are the particular products that you want to look at setting up manufacturing in. But what we've put is some of the segments that we see opportunities for companies to partner with South African companies, or companies to come in and set up facilities within that. And of course, we have the different associations and the different institutions that we can put you in touch to be able to take those discussions further as well. This is just in terms of the vaccines and who are already playing in the vaccine space. Aspen Pharmaceuticals, which is a South African company that already has a facility within the Eastern Cape, and also partnered with a number of other companies. BioVac, which is also in the Cape region, that is also looking at vaccine manufacturing itself. And then you also have Afrigen, which is, you know, playing in the research and development space, already attracted, you know, over 1 billion in terms of grant funding to be able to be housed as the MNRA manufacturing hub within Africa and as a center of excellence itself. Of course, the list is not exhaustive, so we would certainly like to see some of the companies that are here today being placed on the slide next year, so that when we are showcasing these companies, we also have your companies on these particular slides itself. This is just, you know, some of the companies, and not just in the healthcare sector, but that have chosen South Africa as its global presence and has a global presence. And in some of these companies, we've seen incremental investments in the companies itself, continuing to strengthen the footprint not only in South Africa, but on the region itself as well. Just our special economic zones. So whilst Tanya put up a slide that focuses on where the healthcare sector is being hubbed, our special economic zones are the location that you can set up in. And these particular special economic zones have a suite of incentives associated with them. These particular special economic zones, should you be looking at specific zones, we can then put you in touch with the representatives from these zones that are able to then provide you with information relating to locating in those special economic zones itself. But in terms of the Dube Trade Port, the OR Tambo, cooker. These are all being positioned for healthcare and healthcare sector opportunities itself. The incentives, whilst we have a number of different incentives across the different sectors, I think what's critical for yourselves is the innovation incentives, so the technology and human resource development and support program for industrial innovation. In terms of our manufacturing incentives, certainly the manufacturing support program, the Black Industrialist program, and the strategic partnership program. In terms of export promotion incentives, the export marketing and investment assistance, the sector-specific incentive program. This has actually allowed for South Africa to have a pavilion and to have a presence at Africa Health itself. And in terms of infrastructure investments, through our Special Economic Zone program and our Critical Infrastructure program. And of course, we have individuals assigned to providing support and information on this through our Strategic Partnerships and Customer Care Unit within the department, so we're happy to facilitate those engagements. Just some of the free trade and preferential trade agreements that we already have in place. When you set up in the country, you have access to these particular markets, and utilization of the preferential agreements and the free trade agreements, and the latest one being the Africa Continental Free Trade Area that allows you to trade into Africa itself. So whilst the SADC Industrial Participation Program looks at healthcare as one of these sectors that can be further enhanced, we would encourage companies that set up in the country to look at utilizing and optimizing on these agreements. We have a unit that focuses on the different agreements, so if there's a specific agreement that you want more information on, we're happy to share that with yourselves. Just our website that has a wealth of information, and we would encourage you to look at this website. It also has the value proposition for investing in South Africa, fact sheets on the different sectors, and testimonials by companies that have set up their investments in the country. This is something we did for SMMEs in partnership with the World Bank. It really gives you the A to Z of doing business in the country, and it provides you with a toolkit and resources on all the regulations, etc., that you need to know as a company setting up business within the country itself. And again, we'd encourage you to look at this particular website because it also has a number of testimonials as well associated with it. Our Energy One-Stop Shop, in terms of if you want more information, we certainly can provide you with the contact details of who to engage with the Energy One-Stop Shop, but a wealth of information already on this particular website. And then just a bit more information in terms of the non-financial support that can be provided, especially on the Energy One-Stop Shop itself. It's more on the technical, administrative, and the unblocking services that we provide in terms of that. And then just some of the reasons why we always encourage companies to invest in the country. This is just the contact details of our head of the division, who is responsible for attracting investment into the country. And then this is the team that's responsible for the healthcare sector, led by myself, and then it's Mr. Vivanzu Malale and Ms. Ritumetsi Mposo. We also have Mr. Fick, who looks at the rollout of the one-stop shop. And should you require visa facilitation, we have it embedded within Investment South Africa through Ms. Fulna Bernard. I think that brings me to the end of the presentation. Thank you so much for your attention. Thank you.
Excuse me?
Yes.
Can you turn back to the slide that about the biomedical industries of South Africa slide?
Not this one.
Skip the explanation before. Yeah, that.
This one here.
Yeah.
So just focuses on some of the developments that have happened in our pharmaceutical and medical devices sector, some of the instruments that have been accessed by and through government by the companies itself. So Aspen Pharmaceuticals, which is a leading South African pharmaceutical company that has set up through the Presidential Investment Conference a facility in the Eastern Cape, and that has also involved in the vaccines through the partnership with Johnson & Johnson. And then with regards to a partnership that they've just signed recently with Novo Nordisk, especially in terms of insulin and using that facility itself. And then in terms of BioVac, which has partnered with a number of international agencies looking at vaccines. So not only the vaccines for particular diseases, but looking at the overall element of vaccines itself, and has now also initially partnered with Sanofi, and now is partnering with, of course, a number of other institutions to be able to look at local production of vaccines with other diseases itself. And then we have the MNRA hub within Cape Town itself. That is also a center of excellence that has been established in Cape Town to be able to look at research and development. So something that I didn't cover, and apologies for that, we also have leading tertiary institutions.
Actually, as far as I know, that the number 4 is kind of cooperation with the Korean company.
Which one?
The number 4.
Yes.
That is the kind of collaboration.
Yes.
The Korean company to U Biologics and then the Korea's foundation, right?
Yes, yes, yes. And we know that also with the MNRA, they are also partnering with a number of countries, and they are also looking for partnerships for joint collaboration itself, and certainly would welcome the collaboration with Korea itself. Over and above that, we do have scientific institutions like CSIR, institutions like the universities that are already doing leading research and development itself, and that could, not only we would encourage those type of partnerships, but we would encourage for Korean companies, Korean institutions to partner with these institutions to be able to take that research and development. And there are many lessons that we can also learn from the Koreans, and also some of the technologies in which you're already leading in that South Africa can benefit, and not just benefit for South Africa, but benefit for the rest of the region as well. And we would happily share and facilitate those engagements should there be a need to engage further on with these institutions as well.
Okay, thank you so much. Yeah.
Thank you very much.
Thank you, Ms. Rashmi, for that, shedding light on the significant opportunities available in the healthcare industry in South Africa. My apologies, the ambassador has another schedule, so unfortunately he's not able to stay for the remainder of this presentation. Up next, please welcome our next speaker, Ms. Sarah Cohen, the Executive Officer of the Southern African Laboratory Diagnostics Association, for a presentation on in vitro diagnostics and industry perspective. Thank you.
Thanks. So good evening, everyone, ladies and gentlemen, and thank you for the opportunity to talk to you about SOLDA. We are an association that have been going for approximately 23 years. I'm Sarah Cohen, the Executive Officer. I'm also an independent consultant in the IVD and laboratory industry. So just to speak to you a little bit about who we are, who's SOLDA, the Southern African Laboratory Association. We aim to lead and highlight the relevance and impact of IVD, influence patient lives and well-being, improve access, propel the market within the Southern African region, and we actively engage with all the necessary stakeholders, public, private, advocacy groups, patient groups, about the value the industry brings to the patients. You can see there our executive officers, our committee, These are volunteers who sit on a term of office of 2 years, and they represent some of our member companies. We have approximately 6 member companies. Some are multinationals and some are local manufacturers, importers, distributors, and wholesalers. So what are our objectives? We represent the industry, which is obvious. I'm not going to go into a lot of detail there. We engage with the health sector and business environment, looking at changes affecting the industry of our membership and the broader RVD industry. We also engage with regulatory authorities and legislative advocacy is what we do. So we're working on all of that, any measures that change the industry in the Southern African region. We also promote the value of RVDs in the healthcare sector and the broader business community to interact with other health sectors. So we partner with other associations like SAMED and MDMSA, as well as business stakeholders as may be required from time to time. Those are some of the entities that we engage with as well. You can see mentioned there the Department of Health, the DTRC, and SAPRA, amongst others that we work with. So just discussing RVDs, we want to look at RVDs that are designed and fit for purpose, and obviously there are a lot of regulations attached to that. RVDs fundamentally differ from traditional medical devices, vaccines, and drugs, and they are not ingested. They do not treat patients per se. They're non-invasive tests that are used on biological samples, and so there are many risks posed by RVDs to patients on the information provided. If we look at the value of RVDs, you can see that about 70% of RVDs are used on clinical decision making, but only 2% of the healthcare costs come from RVDs as well, but they do play a critical role in healthcare. You can look at this slide that looks at the whole value of diagnostics chain. So the patients are most critical, and that's where the impact is made. The healthcare providers, really important here, looking at turnaround time of testing and operational costs, as well as the quality of the RVDs that we produce, the reliability and reproducibility. With healthcare professionals, they need those for patient management, so we want a rapid, appropriate clinical response, and we want to avoid unnecessary, ineffective testing. And then we need to look at the healthcare system and the RVD role that it plays, the inpatient triage, avoiding cost of disease progression, waiting times, avoiding any adverse events, reducing hospitalization, and the shift to community care. And when we look at access, that is what we're focusing on. We want the RVDs and diagnostics to be available to all our populations on the continent. So if we look at diagnostics importance, if you look at the global population, and this was the Lancet Commission that did an investigation looking at access across the continent, so there's very limited access in low to middle income countries. And what are our disease burden looking like in Africa when you look at the importance of diagnostics? And I was asked to speak about what diagnostics do we actually need? What are our priority areas? So to mention HIV and AIDS, we need the early detection. That still remains critical for effective management. For TB, diagnostics are essential for controlling the drug-resistant TB strains. Malaria, still a problem. In 2020, Africa bore 95% of the global malaria cases and 96% of malaria deaths. So we need early and accurate diagnosis to reducing the mortality rate. What about non-communicable diseases? Tanya spoke to that, but also from a diagnostic perspective, sometimes there's a poor diagnostic infrastructure leading to late detection. The early detection is really critical. And then what about maternal mortality? Africa has one of the highest maternal mortality rates globally at 533 deaths per 100,000 live births. So often this is linked to a lack of diagnostics for prenatal complications. So we need to consider all of that when we're looking at the value of RVDs and diagnostics. Just to refer to some stats from Stats SA 2024, and this looked at the cause of deaths, particularly focusing on South Africa in 2020 and breaking it down by females and males. So you can see there hypertension, very high rate of deaths, cerebrovascular diseases, diabetes. So some of those are not linked to any sort of infectious disease, but they're very important. And you can see COVID also played quite a significant role at the cause of death in 2020. When we look at AMR, antimicrobial resistance, this is really becoming a pattern for us. There's a high AMR burden in the sub-Saharan region in Africa, and often these are not classified or high or critical in the WHO priority pathogens list. You can see some of the pathogens that they are focusing on as critical and priority: Enterobacteriaceae, where we're seeing a lot of carbapenem resistance, and we need third or higher generation antibiotics to deal with that, Acinetobacter, as well as Mycobacteria tuberculosis. High priorities again are Salmonella typhi, your cholera, your Shigella species, and Enterococcus faecium, Pseudomonas aeruginosa, Neisseria gonorrhea. A lot of work going on that because of the high prevalence in the continent and in South Africa, as well as Staph aureus, which becomes a real burden in as far as hospital-acquired infections are concerned. So the ones that are not listed in the WHO priority pathogens list, we need to take account of, and those are group A and B streptococci, strep pneumonia, Haemophilus influenza, and Klebsiella pneumonia. And those are some organisms that we need assistance with testing, because the testing parameters are sometimes take very long and to do in the laboratory. So AMR burden cross-cuts disease areas with notable severity. Approximately 55,000 HIV/AIDS deaths are attributable to AMR in Africa, and then also malaria deaths attributable to AMR in the sub-Saharan region. So this is just a snapshot of the WHO priority pathogen list, which I think is important to reflect on. If we look at disease profiles over time, and this was published in 2020 by John Nkengasong, some of you might know him, he's done a lot of work with the PEPFAR and with CDC, Africa CDC, and you look at the trajectory of infectious diseases, emerging and re-emerging diseases in Africa of importance over time. You can see the Zika virus, Ebola, meningococcal meningitis, cholera, measles, of which we've had an outbreak in South Africa just recently, and then COVID-19. Obviously, the ones mentioned at the bottom are re-emerging. You can see Marburg fever is coming to the fore in Rwanda. We have some challenges there. There are clinical trials happening at the moment for a vaccine. Monkeypox is also spreading across the continent. We still have a lot of challenges with HIV and AIDS. Bubonic plague comes to the fore occasionally, as well as yellow fever virus. So we need to think of those diseases and how we address them. If we look at this, reported by Africa CDC, emerging, re-emerging, and other diseases, also reported in roughly 2020, you can see where the diseases are coming up as well. And sometimes we don't have all the diagnostics that we need for rapid testing. So populations are at risk because of this, and there are lots of reported cases popping up across the continent. So when we look at IVDs, we always classify them according to risks, and so we look at the intended purpose or the indication for use as specified by the manufacturer. We're also looking at a lot of point-of-care testing and self-testing. So it's important, if we're going to get self-testing kits into the country, do we have the correct instructions for use for the layperson? Okay, sometimes we have the use for the healthcare professional, but what about self-testing? And this has come to the fore in that we now have COVID testing kits in the country for self-testing. A layperson can go and buy a kit and test themselves. The importance of the information for diagnosis when combined with test results, signs, and symptoms is really critical, and the impact of the result. We want accurate, sensitive, and specific technologies for the public and for the general public health. So when we look at the regulation, I think Tanya, my colleague, mentioned some of these as well. Medical devices, including IVDs, have historically been under-regulated. So the Medical Medicines and Related Substances Act was amended in 2015, and then SAHPRA replaced the MCC, Medicines Control Council, in June 2017, so things became a bit more stringent then. And what the bottom line is, no medical device, including an IVD, may be manufactured, distributed, imported, exported, or sold without a valid SAHPRA medical device establishment license. So that's what we have in place at the moment. There are exemptions for non-sterile, non-measuring Class A medical devices. And then we need to show, when we're doing the application for the establishment license, that we've got a quality management system in place. And what they are mandating from next year is that all companies have ISO 13485. In the past, they were accepting 9001. Now they're becoming more stringent. The next step is the registration of each medical device. We don't have registration yet in South Africa. Other countries on the continent do have registration, but what is critical to note is there's not regulatory convergence across the continent. So if you're doing business on the continent, different regulators have different requirements. So that makes it also quite tricky. But what we are looking at and working on very closely is looking at reliance pathways for devices and IVDs, particularly in classes B, C, and D. So what does our regulatory landscape look like for medtech companies in South Africa? There are lots of entities we need to be mindful of. SAHPRA, our main health products regulatory authority, radiation control, if we're going to look at electromedical devices or anything that emits radiation. There's SANAS, which is our South African National Accreditation System, which assists SAHPRA with ISO 13485, also looks at laboratories that need to be accredited in South Africa. We've got our South African Bureau of Standards, which has got a lot of national standards and testing criteria. ICASA, which looks at anything which has got radio frequency or Wi-Fi or Bluetooth-enabled devices. The NRCS as well has got certain compulsory specifications. And the other aspects we need to look at as well. What about data privacy, cyber security? What about any electronic waste that is regulated as well? So we need to think about that. From a global regulatory landscape, there are a few entities here that you should be aware of. IMDRF, that are looking at different regulations for IVDs as well as medical devices, the IVDR, for example. The GHTF, which is a Global Harmonization Task Force on Medical Devices. So they have industry and regulators forum that was originally founded in Asia, and they work very closely with IMDRF. The FDA and the CE, I think that was mentioned previously. And then there's notified bodies as well. An example that we gave here was TUV, an organization designated by an EU member state to assess conformity of certain products before being placed on the market. So in South Africa, there are also some notified bodies that SAHPRA is now utilizing to assist them with certification to ISO 13485 if you work in the South African market as well. The other trade associations that we work with, for example, Mecomed, who's very strong in the Middle East, Advamed, Medtech Europe, etc. And then you need to consider the import permits that are needed, as well as pre-market registration, technical files, test reports, certificate of free sale, as well as the QMS certificates that are required. So if we look at challenges and opportunities when it comes to South Africa, obviously we have spoken about the revised regulations for medical devices and IVDs which are pending. The fees, I think mention was made of some of the fees for establishment licenses for retention and renewals, the BEE requirements in South Africa, as well as ISO 13485. And as was mentioned before, there's a feasibility study that was just done to start the whole process of product registration. And SAHPRA looked at IVDs, Class C and D devices for priority diseases. So they were focusing on diseases like HIV and like TB as well. And so that is a whole roadmap that they're putting into play. We're not sure when the call-up will be, and obviously there are going to be a whole lot of SOPs as we head towards product registration. What about other issues that we need to face? Okay, a key entity in South Africa is port health. When products come into the country, we've had to deal with some detainments. There are certain export and import requirements through the Department of Health, and if there are animal constituents of the IVDs that are coming in, well, we need to deal closely with the Department of Agriculture. We've listed some of the entities here that require declarations, permits, material transfer agreements as part of the shipping process. What about the footprint in Africa? So there are opportunities to engage with other countries, and I've mentioned some of the entities as an industry that we can engage with, as well as in the SADC region. And what we are working now as an association is to try and see if we can standardize regulation and trade across the continent, just to make importing of products a bit easier, because it creates a lot of challenges. What about the lessons we've learned as regarding pandemic readiness. So there were some lessons from COVID that we could apply to other disease outbreaks and pandemics, and that is the opportunity to grow our industry through public-private partnerships. So as has been mentioned already, we're working towards a national health insurance or universal health care in South Africa. There's been a master plan that has also been developed for localization. So those are the focus areas for the country as a whole in South Africa as well. So what about barriers to trade and other industry considerations to think about? Okay, so as I mentioned before, regulations are not streamlined across the continent. We need good regulatory practices and reliance. What about the patient impact? Okay, so the surge of antimicrobial resistance has just occurred across the globe, and therefore we need new technologies to deal with that. And adding to that, there's been the knock-on effect of COVID-19. So we focused all our energies on testing for COVID-19 when we looked at diagnostics, but then there was a lack of testing for TB, HIV, malaria. So it's led to increased cases globally, impacting the IVD and diagnostics market. And so we need to pivot back and go and do the testing on all those critical aspects as well. We are heavily regulated under international regulations like the IVDR. We need to focus as well on health technology assessment. Tanya mentioned the health technology assessment that Discovery does, but as an IVD industry, if we're going to work in the National Health Laboratory Services, our products undergo a health technology assessment through the HTA department as well, where there's a performance evaluation done. And then what about access to IVD? So there are definitely financial disparities in South Africa linked to access, rural versus urban. And of late, there was the WHO resolution around diagnostics and strengthening capacity. And this morning, we've had a lot of good discussions here at Africa Health in MedLab around how we're going to deal with diagnostic capacity and rolling it out across the continent. The public-private partnerships we need to put in place, the stakeholders that we need to engage with. And then another factor that was discussed, if we're going to have access for all our populations on the continent, we need to think about point-of-care testing. There's a lot of value in point-of-care testing, self-testing, near-patient testing, and research use only kits as well. So there's a great need for that for some priority areas, and we need an essential diagnostic list. The WHO has put that together, but we're also mandating on government and other key stakeholders in South Africa to actually focus on all these disease areas that we haven't covered in the past. So I think that's very important. The other thing, we need to think about the future of diagnostics, digital transformation and AI technology-driven, personalized and preventive healthcare. And so those are some platforms that are of interest, like portable smart diagnostics, smart self-monitoring, intelligent alerts, so a patient can be alerted to change in their heartbeat, for example. Home self-testing, technology-supported self-management, secure automated data sharing, and tests that are rapidly delivered to the patient. So the patient's doctor orders a home blood test to monitor the progress of their heart failure. This is delivered to the patient from the local pharmacy within 30 minutes, for example. So those are some of the technologies we're thinking about in the future. So what are the good some recommendations that we can put together from a market perspective is we do need good regulatory practices. So we can regulate only what is strictly necessary to fulfill our mandate. And in South Africa, we've been working very closely with a number of groups looking at regulatory convergence. So the MGRC is linked to the USAID Alliance. The USTDA is a US trade association as well, and they've got some initiatives where we look at defining the practical steps to regulate and group products to reduce the application costs when it comes to the regulatory applications. We also need to look at organizational capacity required at companies and the regulator, and therefore focus on skills and capacity building. And that's somewhere where other countries can partner with us in the RVD field to build capacity in the Southern African region, because we need to use available expertise from the industry. What about broadening local research and development and innovation? I think there's been a lot of discussion already around the healthcare master plan and localization. Reliance. So we are saying to regulators on the continent accept certification from selected regulators without requiring dossiers that need additional intense review as well. So a streamlining of regulatory processes. We're waiting for the new fees to be published in the South African context, but we want the regulators to be mindful of small to medium industry and enterprises. What about procurement of IVDs and diagnostics? This is going to become really important when we have the rollout of NHI and universal healthcare. How are we going to pool our resources? How are we going to look at procurement of IVDs and diagnostics in the continent and particularly in South Africa? Another important thing to think about is ethical practices of companies, that they comply with a code, so that there's no corruption as well. That's quite important. And then we want to protect and increase the access to IVDs for all Southern African patients. So working together and collaborating with others with the WHO diagnostics resolution, as well as focusing on point of care and near testing. So we're speaking to some of our member companies and asking them, what do we do if we get a foreign entity like yourselves who want to partner with local distributors? How would you vet a local distributor? And so they gave me a few bullet points here that are worth mentioning. Okay, looking at the regulatory certificates which our member companies or partners that you would like to work with should have, whether it's a SAPRA license or whether they have a regulatory certificate from another African regulator, for example, BOMRA, Botswana. What about import permits, export permits? Have these entities got all of those? Are they able to obtain these to assist you to bring products into the country? What about sub-reseller contracts, compliance certification, companies and intellectual property commission, and what about SARS tax certificates and VAT registration? So all those to consider if you're going to partner with South African companies who might be part of SOLDA, and we're very happy to assist you. You're welcome to reach out to me or any of our member companies. A lot of them are distributing at Africa Health as well. So let me end there. Thank you so much for your attention.
Thank you, Ms. Cohen, for the valuable insights into the challenges and opportunities for the IVD sector. Finally, we are very honored to welcome Mr. Sizwe Makaye, the Chief Executive Officer of TechPro Health, to share with us a real-world example of a South Korea and South Africa partnership success story. Thank you.
Thank you very much, ladies and gentlemen. Director General Kim, colleagues that have spoken today, ladies and gentlemen, I think I'll say all protocol observed. I don't know why they are talking about a big success story, 20 years, but this is a story that will incorporate quite a number of companies. So if there are people that represent those companies in this room, I'm putting a disclaimer right now. This is what I call sabotage. Colleagues, let me just give you a story. I think some people will pick up as we go where one is coming from. We got involved in this sector of IVDs since 1999. I had a colleague, maybe some people will know him, his name was Mark Matthews, and we created a company that was called Pentech at that time. And Pentech has been around until a certain stage of its life. But in 1999, there were few rapid tests, especially for HIV and AIDS. And there was Abbott, which was like a gold standard. And those who were in Cape Town can remember a bit, there was a test called Smart Check. which was from an American company that was trying to introduce those tests here in South Africa. So we started distributing a little bit of smart check in KZN, but because there were few problems that we're having, which talks to localization, compliance, and also maybe a code of good governance in terms of how we deal with these IVDs. So we decided to look outside of the country again, and we approached Standard Diagnostics. Standard Diagnostics that time was still run by Dr. Cho. That was 2000, and we managed to start a pilot project in KZN with their test. We can remember, I think I've got Sarah here and I've got Tanya will testify that at the beginning, KZN was known as the province that has more prevalence. It still has, they say, but you know, for me, I look at Gauteng and other economic hubs as epicenters of any disease actually that is transferable, especially sexual transmitted disease, because that's where people go to for work and other stuff. So they go back to their homes, but I think the epicenter, I still think that it's around Gauteng somewhere, but they don't quote me for that. I'm just, it's just based on experience. So that pilot project led into us having a local tender in KZN or project that led to a test that was called the SD Bioline being rolled out again in the national level. In 2010, there was a little bit of a change in partnership because SD Standard Diagnostics was bought by a company called Alia. Alia then bought anything that has to do with Standard Diagnostics, that included Pentec, who were the representative of Standard Diagnostics in South Africa. But there is something that is key that has been mentioned by every speaker before me. South Africa is indeed a gateway into Africa. We started with SD Bioline here. We ended up having it distributed in all SADC countries, and it led up to Ethiopia and all the other countries of Africa. So it started here, and that is history that is proven. And when that happened, we thought, okay, we are part of the Alia group now. We are still distributing SD, which is the painful part about being a distributor. That is not a manufacturer. And we'll talk about it when we talk about localization, because you can get short exchanged at any given time when stocks are looking good wherever they are. But I think that's nature of business. And we then had to be part of Alia, and Alia then became Abbott within the certain period of time. That's when I decided then, okay, let me try and find my foot again, which was the period of about 2016 to 2019 and so on. So we met again with Dr. Cho, who was no longer part of the bigger picture with Abbott and so on. And we said, what are we going to do again? And we converged in Kenya, and we started to talk about new technology that talks about the advancements of other IVDs. We looked at what is critical in our African market. We looked at HIV and syphilis combination, which we started working on it. They had the HIV, but we said, what about those women that goes to paternal clinics that are not tested for other diseases like syphilis and so on. So in 2020 to 2022, it was an unfortunate situation, but SD Biocenter was one of the companies that the World Health Organization gave them the right to distribute their rapid diagnostic test when it comes to COVID-19. So we did start here in South Africa to distribute again those tests through the Global Fund. We started then registering almost everything that has to do with the tests that standard diagnostics can do. And we then introduced 18 months ago, 2 years ago, the HIV syphilis combo that is now in rollout with the National Department of Health in almost all the provinces, except the Western Cape started a little bit late. And I know that there is maybe a possibility of the renewal of that project. So all in all, we've worked with Standard Diagnostics, a Korean company, for 20 years. They've developed, based on our basic market analysis, some of the tests, like maybe Sarah was saying, that we need to look at the new technologies and other stuff. We are working currently on a number of things. I think those are just old photos. I'm sure some pictures can appear there where we started to go around to SD to try and see whether we can make a partnership. Those are the African distributors that we managed to combine together. That was in 2005. I think it's important to share that picture because at that critical stage in South Africa, there was still an issue politically of whether this disease is really something that is going to hurt. So I'm not going to get into politics though. So we just changed the partnership, as I've said, and we moved on then to achieve some of the critical stuff, like the recommendation on the syphilis HIV combo. This is another important milestone. I think the SD guys that are here can talk about it maybe later. We got this first project starting in South Africa through DOH, and we managed then to get Standard Diagnostics again, having a more than 7 million kind of testing project in Korea and in Ethiopia and also in other African countries, based on what was recommended here because of our gold standard when it comes to compliance and so on. This is the product that we also distribute currently, but this is the major achievement that we've had in the past a few years, to be able to introduce that product into the public sector and also private sector. We are happy what Kotra has done for us. For example, in June, there was Africa Summit in Korea, which we participated. There was a presence of South African companies and also government officials, but it was not that much. But through that relationship, we've managed to identify other technologies in terms of IVDs that we want to bring in. And we've signed those contracts and we are engaging the medical aids, because where we want to be, I don't want to do a repetition of what has been said, but we are looking at making sure that we bring point of care closer to the people. We are looking at the diabetes market with a certain medical aid scheme to say how can we help people that are at home? How are we going to do make it easy for them to actually achieve what their diagnostic immediately before it hurts. So we are looking at different technologies and we are engaging with other Korean companies. But what I want us to take home is that our relationship with the Korean companies has been great. We've received some few awards through Kotra and also Standard Diagnostics, recognizing what we've done with them over the years. The beauty about the partnership with them is that we can listen to each other. We can sit down and analyze the market. We can also talk about the creation of other new products. They are not scared to invest in proper technology, because I'm saying proper because I've been around the world. We've looked at different countries. We've sat down with different people and they want to cut corners. But we are currently looking at exciting new technology that we would like to introduce into the country. That was it for me. I'm not going to talk too much again about manufacturing. I think it's been overstated in this meeting. But I would like to work with the TIC. We've tried before. but the economics of scale at that time were not good enough. But with the trade agreements that we now have in Africa, we can then not look at South Africa only, because we can't create a proper IVD manufacturing factory in South Africa when we are still talking about testing 50 million people. So we need to look at Africa and other countries as our market. But thank you very much, ladies and gentlemen. I don't have much. I just wanted to share that short message.
Thank you, Mr. Makaye, for sharing your inspiring journey and your success story, which demonstrates the potential of collaboration between South African and South Korean companies. This brings us to the end of our seminar program. We would like to thank all the speakers for their contributions, and we hope that this seminar has provided you with valuable insight and a new perspective of opportunities available in South Africa. After the seminar, there will be a dinner event in the Lily Room of this hotel. I will direct you to the dinner venue shortly, but thank you very much to everyone, and have a good evening. Thank you very much. Okay.